We'll move on now to roll call.
Michael Doherty,
Present.
Fred Chmura,
Here.
Jeff Kelleher,
Here.
Phil Perisville,
Here.
Ivor McDonald,
Here.
Marilyn Parker, Wendy Costa, here, Margaret Hoyt.
She's not here.
Is she online? Ivor,
She is not,
okay,
as far as I can tell.
absent, and Michelle Watts here.
Thank you very much. And the next thing would be, we have an addition we would like to make to the agenda.
Could we just check with our recording secretary that everything is fine since she is remote?
Certainly, yes.
Speak up, we can't hear you back here.
All right, thank you. So just checking with our recording secretary who is joining us from Zoom. We want to make sure that the AV is working for folks online. Dottie, can you let us know if?
Good
you're able to-
afternoon, everyone. I am busy trying to make the closed captions work. I have gone to settings, and under settings, it's accessibility. So I've almost got the captions working, but I'm here. So thank you for checking.
Thank you, Dottie. All right, so as I say, the next thing is we'd like to add an item to the agenda. Michelle, did you want to?
I'd like to make a motion to add the following 2 items to the agenda. And number 6A, to have a presentation from the Woodstock EMS. And item 6B, to add a questions and comments following thereafter.
You have a second on that?
I'll second.
All right, 5 seconds. Is there any discussion on that? Hearing none? Jeff? How do you vote? Fred?
All right.
I vote aye.
Please, can't hear you.
Can't hear you. Yeah, don't you have a microphone that you can use?
And here's Johnny. All right, so far on the motion, we have Jeff Kelleher, we have Fred Chmura, myself, Michael Doherty, and now I'll pass it to Michelle Watts.
Aye.
I don't need a microphone.
Yes, you do.
Yes, you do.
Aye.
Aye.
All right, so the motion carries. We will add items 6A, which will be a presentation by WEMS, and 6B, which will be the following question and answer for WEMS. And now we'll move on to the next order of business, which is the reading of the public notice. Town of Woodstock notice of public hearing, March 24th, 2026, 7 p.m. at the Woodstock Middle School cafeteria. The Board of Finance of the Town of Woodstock will hold a public hearing at the Woodstock Middle School on Tuesday, March 24th, 2026 at 7 p.m. in accordance with Section 7-344 of the Connecticut General Statutes. Itemized estimates of expenditures of the Board of Selectmen and the Board of Education will be presented, and the Board of Finance will hear all persons who wish to be heard in regards to any appropriation which they are desirous that the Board of Finance shall recommend or reject for the fiscal year ending June 30th, 2027. That was signed by myself and dated the 10th of March, 2026. All right, the next order of business is to elect a moderator. Do we have a nomination for moderator?
Nominate Dawn Adaletta.
Dawn Adaletta has been nominated. Are there any other nominations?
You need a second on those? I'll second.
Nomination. All right, do we have a second on the nomination for Dawn Adaletta? And your name, sir, for the record?
Lynn, Lynn. She knows me.
Well, we have to have it for the record. And some of the people out there might not, Paul, but thank you very much. All right. All those in favor, please say aye.
Aye.
All those opposed? Welcome aboard, Dawn.
Give her the microphone.
Yeah.
Yeah, that'll be for the presenter, and then if you'll take that mic.
Okay.
If you have to turn it on, when you go, okay? So.
Good evening, everybody. I trust you'll let me know if you can't hear me. I'll watch for this. Just some housekeeping things. We have presenters listed on your agenda that will come up and speak after they've finished. If you have a question, please come forward so that you can use the mic for the question. Even if you can project through the room, we want to make sure the people that are zooming in can hear you and your question as well. So please come forward and state your name and then ask your question, and whomever you're asking it of will answer it. So we're starting with the general government's budget. And I believe that's Chandler who's presenting. So you're on.
Thank you. Good evening, folks. Great to see a nice turnout here. This is a very important meeting as far as you get a chance to actually speak your thoughts on the budget, ask questions, and hear firsthand how
Speak into the mic.
the budget was brought about. I'd like to say thank you to Karen Fitzpatrick and her assistant Diane Converse for all the work that they put into helping the Board of Selectmen get to this point. And thank you to Kate McDonald and Chris Mayhew. We've had multiple meetings over the last several months, talking to boards, commissions, department heads, and gaining as much information as we can to come up with a responsible yet acceptable budget. Our goal was to try and keep the budget as close to 3% as possible. We felt that it was very important, especially after last year. It took 3 chances for us to pass the budget, which means you people spoke. And that you let us know that taxes are difficult and you want to try and keep them as low as possible while retaining your services. It was also a reval year. Unfortunately, valuations of your home have gone up, and that's based on the state required revaluation program. So that again is another reason why we felt it was necessary to try and come in as low as we can with our budget increases. The other thing that happened was because we didn't pass a budget in time to get the tax bills out on time last year, we ended up with a supplemental bill. And that put another sour taste in some people's mouths because another bill came after you've already paid your tax bill. So that was some of the drivers that pushed the Board of Selectmen to get to where we are today. The Board of Finance is the budget-making authority responsible for financial and taxation matters, representing the annual operating budget and special appropriations to the town meeting for approval, establishing the tax rate, approving a budget that covers the cost of town services, is fair to the taxpayers, and is fiscally responsible. The Board of Selectmen is responsible for the general government budget. We review budget requests and submissions from department heads, boards and commissions, outside agencies that provide social and regional services to the town. And the Board of Selectmen creates and approves a general government budget to present to the Board of Finance. The finance director and treasurer they're the custodian of all town funds and manage the general government budget once it's approved at referendum by the town voters. The finance director works with the first selectman in preparation and administration of the annual budget, monitors and analyzes department budgets to identify potential budgetary concerns, prepares the Board of Finance meeting agendas and provides essential information to the board, and works directly with the Board of Education business manager for record keeping and accuracy of Board of Education expenses and revenues. The Board of Education is responsible for creating and approving the budget for the education department to present to the Board of Finance and managing the Board of Education budget once it's been approved at referendum by the voters. The 27 fiscal year general government budget proposal. The Board of Selectmen are presenting this budget based on requests received from outside departments, boards and commissions, outside services that provide social services and regional services for the town. Board of Selectmen have a responsibility to the citizens to create a budget that is not only fiscally responsible, but also address the needs and priorities of town services. The original budget request brought to the Board of Selectmen was $6,844,573. Adjustments have been made to approve a responsible budget while maintaining the services that citizens are accustomed to. The proposed budget being brought forward is $6,748,969. That is an increase of $181,695 from last year's budget. Board of Selectmen have carefully planned the allotted funding and top priorities needed to effectively operate the town. This budget proposal in the amount of $6,748,969 reflects approximately a 2.77% increase, and that is including debt service. The combined budget breakdown decrease in debt reduced the general government budget to an increase of 2.77%. As far as the overall budget, the Board of Education is $24,773,374 for a 4.97% increase. General government budget, $6,253,529 is a 3.16% increase, and redemption of debt is a decrease of $495,440. General government budget increases and decreases. The debt service decreased by $9,612. Public safety increased $79,782. Highway, $46,912. Public health, recreation, and welfare, $33,032. Insurance and benefits, $14,367. And the general government, $76,002. The proposed budget, as you can see up on the board, we have different percentages for the increases. The highway department is 22.83% or $1,541,199. Public safety budget is $1,525,312 for a 22.60% increase. Debt makes up 7.3% of the budget, $494,440. Contingency, $64,000. The general government is $1,301,567, and insurance and benefits is $1,135,465. I do have a list of what these different breakdowns mean for the town as far as services. I can go through them all if you'd like. I can go, it's a breakdown of highway, insurance, benefits, public safety. Would anybody like me to list those out for you so you get a good handle on what these different numbers include? Or if anybody's got any questions later, I'd be happy to come back to this if you'd like to see it. Cost savings to the taxpayers. There's no salary increase for the first selectman, Board of Selectmen, or the Director of Public Works. We reduced the department head salary increases to 3%, minimal increases to boards and commissions. We're investigating cost savings to the transfer station to try and keep permit fees down and continue to operate. Reduction in cost of advertising. Reduce open space funding by investing into high yield CDs, reduce requested increase to the Woodstock Fire Protection Apparatus Fund, I'm sorry, reduce requested increase due to previous ARPA funding in the allotment of $1.3 million. We've transferred some town-owned parcels of land that have little or no benefit to the taxpayers, putting the land back on tax rolls, earning more interest by investing town funds, reducing the assistant town clerk to a part-time status, working with negotiating contracts and outsourcing certain services, applying for grants, coming up with better efficiencies to data processing and switching to automation. The first selectman and the board of selectmen also volunteer to do repairs and maintenance to the town hall, saving having to hire outside contractors to take care of that work. Next on the list, we have the 5-year capital plan. They include all kinds of different projects based on prioritizing by the DPW director. We have highway department as drainage, grinding and paving. We also have bridges. We have fleet operations, including equipment. We have the fuel depot expense, transfer station, and the general government, which covers other, certain things like benzene cleanup, evaluation, fire protection, and a few other things. The 5-year capital plan for the town of Woodstock this year is $16,837,000. Please remember, this isn't a plan to commit to spending this money. This is just prioritizing future expenditures so that we can plan ahead and see what's coming down the road so that we can try and secure funding. And it's also the only way we can work with certain grant funding is if we have these projects on the capital plan. The 27 estimated revenues are the amount of revenues that we anticipate receive on the budget. The over line item is surplus from the fiscal year 26 that helps to offset the New Year's taxes. The fiscal year 27 estimated revenue is $36,104,029. The total combined proposal of both the education and general government budget is $31,522,343. This estimated mill decrease to fund the combined budgets would be approximately 3.79 mils. That is based on a collection rate of 97.5%, which is based on past collection rates. The revenue reduction would be $4,581,686, which would bring the proposed mill rate to roughly 20.62 mils. Any questions on any parts of the budget?
What is the current mill rate now?
I'm sorry, ma'am, could you come to the front and ask a question with the mic? Or I'll walk to you. How's that?
Yes, my question is, what is the, Andrea Tannen. And I'd like to know what the current mill rate now is, because every time I look at the numbers, they keep going up.
The current mill rate is 24.41 mils.
And what was the increase from last year? I'm sorry, what was the increase from last year?
1.37. 1.37 mils,
1.37 mils.
about 1.2 million.
$1.2 million.
So every year we have an increase in the mill rate. Is that correct?
Typically, yes, but this year, because of reval, there is actually a proposed decrease in the mill rate.
Yes, but our evaluations went up. Where is the money going?
I can give you a copy of the line items. It's to cover all general services. Highway, insurance and benefits, public safety, health, recreation and welfare, redemption of debt, and general government expenditures. That's the general government. That has nothing to do with the Board of Education side.
Okay, but my income does not increase. So where are we?
I'm not sure I understand the question.
Well, I have to have enough money to pay the taxes on my house, and I also am in the Bungie Lake District, which is an additional tax because we are a separate district. So that only adds to the taxes that I am responsible for. So how is this budget going to help me?
By providing services. By
What kind
keeping
of services do I get?
911 services, EMS, children in the school system, general running of the budgets, roads, bridges, just the general cost of running a town.
Yes, but you don't do the roads in the Bungie Lake District. We do that ourselves.
That's correct. Those are private roads and not the
That's
responsibility of the
correct.
town. That's
So-
why you pay a separate tax.
That's correct. So that needs to be taken in consideration because we are double taxed.
You're double taxed because you live in a tax district.
I know that. Of course, they didn't tell us that when we bought the house, but that's beside the point at this now.
Okay, but because you live at the Bungie Lake District doesn't change the fact that you owe regular Woodstock taxes. Cost of running the town goes up, just like the cost of running your vehicle, running your home, insurances, gas, groceries, everybody's bills go up. So the town obviously has the same issue. We have
Yes,
to buy oil, we have to buy electricity as
well,
well.
that's true, but when you live on Social Security, that doesn't help.
Did anybody else have a question? Well, I'm out there. Thank you.
Hi, my name is Bob Brittenberger. I just have a question on the 5-year capital improvement. I may not understand all this, but it looks like 2030, 2031, it's going to be a huge increase in costs. So I might have to move before that.
This is,
Am I reading this wrong?
These are, these are numbers that were originally projected when the projects were recognized. A lot of these numbers that you see aren't necessarily the years that these projects are going to take place. If you look at some of the road budgets, Prospect Street, the original request and thought about was 2013, 2014. Unfortunately, it takes a long time to get these projects together and funded.
Okay, so page 1, the totals for the year, 2930 says 925,000, and the next year it says 6 million. That's a big difference.
If you look, these are projections moving down. The final number, the 14,000 at the bottom of that page, is the total of all the numbers to your left.
Well, the one just to the left of the 14,000 is a big increase from the one 2 spaces over.
Because that's when some of these larger expenditures, like if you look up that column, the 2030, 2031, there's $4 million for the Woodstock Road Bridge. There's some very large expenditures that are expected to happen roughly in that timeline.
Thank you.
You're welcome. Thank you for the question.
We have another question in the back.
My name is Margaret Adams.
My name is Margaret Adams. I live in a condo. There's 56 of us. You don't plow us, you don't sand us, you don't mow us, you don't do anything other than police and ambulance. And I pay, there's 56 of us and we all pay over $3,000 in taxes every year. And I'm saying, why? What do you do for us? We just pay you.
Again, we provide the services.
What service?
I can go over it again if you'd like.
What service do you provide to our
We-
condos?
Our services are not based on individual usage. Our services are what it takes for the entire town.
I understand that, to plow and to sand and do all that stuff. You don't do any of that for us.
How do you get to
Collect
your
over
house?
$3,000 from 56 units,
How do you get to your house?
huh?
How do you get to your house?
On the road.
On the road.
Mhm.
The road that you're saying that you don't get,
You plow the main road, but you
Yes.
don't plow the condos.
we don't plow individual driveways.
Okay. It doesn't make a whole lot of sense.
We have another question back there. We have a deferred comment. Okay.
Hi, Joan Ford. I'm just a little concerned that you've under budgeted gasoline and diesel.
I'm sorry.
I'm sorry. I'm a little concerned that you're underestimating what you're going to pay for gasoline and diesel next year, given the cost of gasoline and diesel.
I'm sorry, I'm very, very deaf. Even with hearing aids, I have.
Can you hear me, Chandler?
Yes.
She is afraid that you have underestimated the amount we'll need to spend for gasoline and diesel, given how quickly the prices are rising right now.
Once again, these are budgets. These are estimates. There's no way that we can determine a year in advance what's going to happen with prices. We also couldn't estimate the cost of snow removal and mud season and all the other dirt road issues that we're having, trees down from the storms. These are estimates. Budget is an estimate. It's not, this is what it's going to cost, because it's not set in stone. All we can do is look back at what it's cost us in the past. Unfortunately, there isn't anything we can do, and there is no way that we can budget for an unforeseen future problem. Thank you for your question, though.
Jim Donnelly, Pulper Rock Road, Woodstock. Thank you for the opportunity to talk tonight. I may be arriving late in the scene. I almost 2-hour commute to get here. Like this? Okay. Like I said, my name, Jim Donnelly. My name is Jim Donnelly, Pulpit Rock Road. Can you all hear me? Thank you. I'm getting here a little late. I had a 2-hour commute. 2 items. I'm looking at reduced requested increase in WFPA fire apparatus budget due to ARPA funding. Can you explain that a little bit to me? I may have missed a point. And also reduce open space funding. Quite frankly, I moved to Woodstock because of the open spaces. I had many opportunities where to relocate, where to take my family. I choose a rural setting because it seemed very proactive on open spaces. If that's being called into jeopardy, I'd like to know about that. Many people can vote with their feet where they choose to live. I choose to live in Woodstock for what it is. Open spaces is part of that. And to address the fire apparatus reduction, and then I may have a follow-up comment. Thank you.
You're welcome. As far as open space goes, open space right now has about $700,000 in their acquisition fund. The acquisition fund has been put into high yield CDs by the finance director, Karen Fitzpatrick. They, in the last 7 months, interest on that investment was about $19,500, which goes directly into their fund. Also, they receive all the PA 490 penalties when someone's in the PA 490 tax break. When it comes out of that, if there's any penalties, that goes directly into the open space account. And they have also, in the last 12 months, gotten a total of $82,500 added into that fund from the sale of town-owned land. Based on those, all that extra revenue, we felt it was very safe to drop the increase requested in the budget. As far as the apparatus for the fire departments, over the last couple of years, they've received $1,287,767 from ARPA funding and an additional $144,346 from the capital non-recurring account. Even though that we've reduced the expenditure for the apparatus purchasing, they're still getting a 3.78% increase to their budget over last year.
Thank you. I'm hopefully holding the microphone in the right position. It's my understanding that the requested funding to the fire department, that they had requested to be reduced for upgrading or replacing apparatus. Others from the fire department probably in a better position to speak to the age of our fleet, which is quite old. Many of us drive cars that are probably half or a third of the age of our emergency responder equipment. I would certainly hate to see a fire call where our firefighters are in a building and a pump on one of our trucks failed because it's almost 40 years old because someone's trying to save 20 grand. But I'll let you address that. Thank you.
If you look at the minutes from the meeting that the Board of Selectmen had with the fire departments last year, it was stated by Dick Barron and by Travis Blair, the chief at the time, that Woodstock is better equipped than any town in the area. We have 3 different departments so that we also have extra coverage if there's an issue with a piece of equipment. From one fire department, we have 2 others, plus we have mutual aid from other surrounding towns. I have been in contact with the chiefs of all 3 fire departments, and we are setting up a meeting to discuss long-term plans for these giant apparatus acquisitions.
Next question.
My name is Christopher Whitehouse, 500 Westford Road in Ashford, Connecticut. Kind of an alien here, but I'm here in my capacity as president of the North Woodstock Library Association. I noticed the glaring omission of the fact that we have been defunded or recommended to be defunded. I'm not sure that people are aware of that. We feel it's a very unjust decision. We would respectfully request that the Board of Selectmen reconsider their decision, and we would ask the cooperation of the Finance Board as well. I won't go into the nitty-gritty and the details, but just to make people aware that we had the lowest budget minus bracket. We run a very efficient, frugal thing. We feel that we have a very important contribution to the North Woodstock community. But my presence here tonight is bifurcated. Anybody who has ever needed an ambulance or a fire truck breeds empathy for the funding. I'm here to advocate for anything that you feel is need or want. And anybody who ever had an ambulance call for a loved one or a fire at their home, I don't want to write a open check, but we heartily endorse and support anything you folks wrote.
Robert Baumler. I want to say that the 2 best departments that we have in town is our fire rescue and our highway department. I think they both do a tremendous job. Just want to put that on the record.
Thank you, Mr. Belmont.
Thank you. Any additional questions? Yes, sir.
Hi, this is David Murphy from Shepherd's Landing. I don't know if any of the finance members can offer insight into this. A lot of the budget, obviously 8 or more cents out of every dime is for education. And there's a lot of emphasis on early learning. Is it permissible any longer for a student to stay back in school if they're not achieving grade level? And what would the cost of that be?
That wouldn't be a question for myself. That would be probably best asked after the Board of Education does their presentation.
So get back to you on the Board of Ed. Any other questions for Chandler? One, okay.
Hi, Aaron Farbo, Joy Road. Going back to the North Woodstock Library, what was their request for funding? How much was it?
$31,000.
And it just got cut.
That's correct.
And if it's added into the budget, what's the
I'm
increase?
sorry, I can't hear you.
If it's added into the budget, what's the increase?
I
That
don't,
seems like a literal penny in the budget. You add back in.
our goal was to get below 3%. We came in at 2.77%.
Okay,
So making some difficult cuts.
so if you add in the North Woodstock Library, does it still stay under 3%?
No.
Are you sure?
Yep.
We can all roll together.
Once again, I think reasonable people could agree that rather than defund one library, that in fairness, a percentage could be taken from each of the 4 libraries to still sustain the 2 point whatever it was increase that you want. Okay. I agree with the gentleman about the town highway. I own a small trucking company. Woodstock roads are amongst the finest in the Northeast. They're maintained well. They're always right out on the job plowing. Couldn't say enough good about them either.
Any more questions for Chandler? Okay.
Thank you so much for coming out, everybody. I appreciate your time.
Questions?
No one, I asked folks online to raise their hand if they had a question. No one has raised their hands. We have 40 folks online.
The question was, were there any questions online? And Ivor said, no.
But we do have 40 people online right now.
So next up is item 6A, which is the Woodstock EMS presentation by Chris Rossi.
Yeah. Good evening, everybody. For those of you who do not know me, my name is Christopher Rossi. I am the EMS administrator for Woodstock EMS. We wanted to take some time tonight. I'm here with President of the Woodstock Volunteer Fire Association, Russ Downer. In the crowd as well, we have 2 EMTs from our ambulance staff who are here tonight in support of everything that's going on. We also have some dedicated members of our various fire departments seated over there. So recognition of some dedicated volunteers and EMS professionals who have taken the time here to be here tonight. So we wanted to give a brief presentation on the operations of Woodstock EMS, everything that we're working on, everything that we have been working on, the statistics about everything that we're doing, and an objective goal of transparency. Yeah. So a little bit about who we are as Woodstock EMS. Our staff is comprised of 21 EMTs, 2 EMRs, 1 EMS administrator, director of operations, which is myself. Below me, I have 2 EMS operations supervisors who handle some of the day-to-day operations, most of the day-to-day operations. We also have 1 QA/QI manager. QA/QI stands for quality assurance, quality improvement. That is in relation to our documentation and ensuring that our providers are continuing to provide strong care. So a little bit about those certification levels that I just spoke about. I'm not going to go through them too much in detail because it is a lot of information. However, some key points, the general first aid person class we offer to the members of the public is about 4 to 6 hours of training, covers basic bystander level first aid and CPR. EMR, which you heard me talk about, we have 2 of those personnel on our staff, stands for Emergency Medical Responder. This is a 60-hour training program, which is kind of the entry level for first responders. We have a lot of fire department personnel who are EMRs who can render emergency medical care. Those personnel can provide basic assessment and life safety interventions. EMTs, which make up the majority of our staff, this is what we are licensed as an ambulance service to provide, stands for emergency medical technician. This is a 200-hour training program. This is the minimum certification in order to operate in the back of the ambulance, transporting people to the hospital. This covers a little bit more advanced assessment and interventions over an EMR, things like CPAP, glucometer for blood sugars in diabetic persons, pulse oximetry, which is a little probe that goes on your finger and tells you about your oxygen. This is what you commonly refer to as, you would hear in public as BLS, or basic life support. We have an intermediate between EMT and paramedic, which is called AEMT or advanced EMT. This is a mid-level. They have some more interventions than an EMT, but not quite as much as a paramedic. Paramedic is a 2,000-hour, 2-year program through colleges. This is the highest scope of care in an emergency setting. This is comparable to, say, a registered nurse in the level of training. As a paramedic, we can provide about 50 to 60 different medications, as well as surgical interventions, things like airway control, breathing, things of that nature, IVs. So with that said, what our skill sets are beyond EMTs at Woodstock EMS, this is the people that are on the ambulance providing care to members of our community. So our agency is licensed for BLS, which is EMT levels of care. So we all operate as EMTs. However, we have 4 paramedics, including myself. One of our paramedics is a board certified flight paramedic. She handles our quality assurance, quality improvement. We have 1 EMT advanced. We have 18 certified firefighters, which is about 70% of our staff, who are operating as an EMT in our department. However, they are operating as certified firefighters in the town of Woodstock, as well as other neighboring towns. We also have 1 ICU critical care registered nurse on our staff. We also have 1 teacher and 1 OR surgical tech, who is actually in the back room there, Iris. We all share the same goal regardless of certification, which is kind, compassionate emergency care to the residents of Woodstock. So these are statistics. These are actual statistics that were pulled for the year 2025. Our total calls for service in 2025. This is calls that we actually responded to, 517. Our average response time from call received to time that we are on scene of an emergency is 10 minutes and 7 seconds. Our 90th percentile, so the majority of our response times were between 5 and 8 minutes, and this is throughout the entirety of town. Obviously, Woodstock is a relatively large town, so we try and get there as quick as we can, which shows. The state average for emergency response, just to give a little bit of context, is somewhere between 12 and 14 minutes, so we're actually ahead of that average. So the other statistics that I have, our average shoot time is the call received to time en route. So the time that it takes us from the time that we get our 911 call to the time that we are out of the station responding is 2 minutes and 20 seconds. So that has been drastically improved with the addition of paid 24/7 EMS personnel that are in the station ready to respond. The breakdown of our calls, 333 of our calls resulted in a transport to the hospital. 184 of those calls were not transport, whether somebody refused care, we got canceled en route, things of that nature. I won't break down all of the different hospitals that we went to, but we went all over the place. Now you may be asking why we went to some of these such faraway hospitals. So with our EMS protocols, they designate that certain medical conditions, certain medical emergencies require specialty facilities. Our 2 closest facilities, Day Kimball Hospital in Putnam and Harrington Hospital in Southbridge, are not equipped to handle some of the higher level emergency services that we may encounter. There are also some certain circumstances where we may have a patient who has a specific medical condition with a specialist at a certain facility, which may require us to go to a different facility. So our promise to the community is we're giving back. We're trying to provide additional services other than just emergency settings. We want to interact with members of the public as much as we can so that your first interaction with us is not on a bad day. We've been offering things like blood pressure clinics. Last summer, we were in Roseland Park doing blood pressure clinics regularly throughout the summer. We have File of Life information magnets, which was a partnership with the Commission on Aging for us to have medical information for residents in the event that they are having a medical emergency. We can know exactly how to treat them. We've also been offering routine CPR training. You may have seen us out and about online, putting out CPR classes. As of tomorrow night, we have a couple of people who are finishing up their CPR instructor. We will have 14 CPR instructors on staff. So a big commitment to try and get as much of this education out to the public. We also have been doing first aid training along with that CPR. We also are offering Narcan and opioid overdose training. The next one is actually tomorrow night. We've partnered with Northeast Insurance Professionals to offer a Narcan and opioid overdose class. We've also been offering Stop the Bleed training. We'll have another class opening up to the public soon as we start to get into the warmer weather. We have 4 instructors who were recently certified for Stop the Bleed. Outside of this education to the public, we also have partnerships that we're working on. We have been participating in a job shadow program with Woodstock Academy that has allowed a senior from their school to ride along with our EMS staff and observe emergency operations. She's been with our crews observing operations on calls, day-to-day operations. She's received CPR training. She has received Stop the Bleed training, and she's actually done this with the goal to bring that training back to Woodstock Academy. With that, one of the things that we worked on with her was Stop the Bleed training. She helped us to provide Stop the Bleed training to the CNA program, which has been offered at Woodstock Academy. We've also done training with their residential life staff who are on the campus with their resident students so that they are better equipped in some of these emergencies to respond. We will be offering CPR training for local DCF foster parents in the next month or so. We also will be doing CPR training for employees of Woodstock Building Associates that is actually going to be on Thursday morning. So partnerships with our local community to try and provide training. So getting into a little bit more of the numbers, just in full transparency of how our billing works, how our numbers work, how our income works, how our expenses work. So the least fun part about our job is obviously sending out the bill. There may be a little bit of information that you may not know about EMS billing. So the state actually sets our billing rates. They tell us what we can bill for, what the rate that we can bill for is. The sheet on the right there is the actual sheet that we received for 2026 as our billing rates. It varies based on, mileage plus a set rate for a basic life support care. This is, to clarify, this is only what we are allowed to bill. This is not what we actually receive. What people may not know is that we are allowed to bill a certain amount. However, insurance companies are allowed to pay us exactly what they want, and there's nothing that we can do about it. So it's oftentimes significantly less than what we actually bill for. So now, before talking about the actual numbers of our income and our expenses, I want to talk about where billing income goes. So our billing income that we collect from emergency responses goes to training, supplies, ambulance repairs, and uniforms. So training, we currently pay for training fees for all of the fire departments in town, as well as our EMS staff. So that can include things like initial programs, refresher programs for EMTs and EMRs. We also currently pay for EMS supplies for all 3 fire departments in town, as well as our ambulance. So that includes restocking of used equipment on ambulance calls, EMS scenes, replacing items as they age out if we do not use them and they expire. Also, ambulance repairs, obviously wear and tear items, just like a vehicle that you may drive. We have to change things like tires, oil changes, the operating costs for fuel and diesel. Uniforms as well. We issue all of our employees professional uniforms. We want our professional appearance to reflect the professional care that we're giving to our patients. So our appearance is very important to us. So getting into some of the costs for an emergency, exactly what kinds of equipment costs in a day-to-day operation. So billing only really offsets a small portion of our expenses. So this is an example call that I used. One BLS call, which is what we would bill for, is a BLS service. That's the state set rate of $945. That's our base rate. On top of that, we are able to bill for $23.14 per mile. So for a 10-mile transport to Day Kimball, what we would bill is approximately $1,176.40. Now, like I had mentioned, we often receive significantly less than what we actually bill for. Our average billing that we received per trip from February, so last month, was $471.75. So even though we bill or $1,176 we actually receive, a small portion of that. This billing income does not include services rendered by our regional ALS provider if necessary. Some of our more critical incidents require additional advanced life support that is provided by a regional service, which is KB Ambulance. How that works is that paramedic covers about 9 towns and they respond alongside our ambulance in addition to our crew and provide that advanced level of care. That is a separate company. They have separate rates, much like ours. So giving some more insight into what things cost, this is some of the common supplies that we use that we do not bill for. We simply bill for the set rate plus our mileage. We don't bill for all the supplies that we use. So common things, if somebody's having an allergic reaction, we can give them epinephrine, which is like an EpiPen. 1 vial of epinephrine is $30. Our CPAP, which is used for patients in respiratory distress, is $75. 1 set of AED pads for a pediatric patient, which we hopefully never have to use, is $150. Some more common things that we use on a regular basis is oxygen. So 1 portable oxygen tank to refill is about $33. 1 vehicle oxygen tank, which is a much larger tank, is $42.
On 1 CPR call, we go through 5 small tanks on 1 CPR call of oxygen, not just 1, but 5 to 6 tanks of oxygen.
Yeah, like it mentions at the bottom, some of these complex emergencies can easily require the use of about $500 to $1,000 worth of supplies based on changing conditions, additional things that we require. So it can add up very quickly. Some more things that we touch on. Common ambulance costs for regular equipment, our lifting device, which secures our stretchers into our ambulances. These are DOT approved for patient safety, so that we are ensuring that in the event that there is an accident, that our patients are secured and can be safely transported to the hospital. That is $29,832. The lifespan of one of those is about 15 years. So it's about every 15 years that we have to replace that. The Stryker power stretcher, which is the ambulance cot that we use to transport patients in the ambulance, that is federally required in all new ambulances. Any new ambulance that is constructed is required to have a power stretcher. Those cost somewhere between $25,000 and $30,000, depending on the model that you use specifically. 1 automated external defibrillator, which you can see on the bottom left there, is approximately $3,800. And then on the right there, we have a scoop stretcher, which we use for carrying patients in various conditions. That is approximately $800 by itself. Another thing that we think about is replacement of equipment. So this is the cost of a new ambulance. This ambulance we're expected to take delivery of in the first week of May. This ambulance was ordered prior to the COVID pandemic. So it's been delayed and delayed and delayed because of the chip shortage with the chassis. And then the ambulance company that makes the box portion of the ambulance was affected by the hurricane a few years ago in North Carolina. So the cost for this ambulance, which is a 2026 Ford F450 ambulance, which looks exactly like the one that is outside actually, is $320,589. And that is paid for with a loan over years. Some other things that we that are required for our certification. So the cost of an EMT course to get people who are certified to be on the ambulance is somewhere between $1,800 and $2,150, depending on the program that you go through. Some programs vary in prices. The textbook for this course, which is not included in the course cost, is another $455. So this training for EMTs, as I mentioned, is 200 hours. It's roughly about 6 months. Depending on the program they use. Like I said, some of the programs can be a little bit shorter in terms of time frame, but it's all 200 hours. There's also an additional large yearly continuing education component. All of our employees are required to do yearly trainings on various topics as well as medical trainings every year to maintain certification with our sponsor hospital. So as I mentioned, we have a lot of staff who have advanced level training. All of this training is paid by our own pocket. So things like paramedic, advanced EMT, registered nurse, all of us seek this higher level of education in order to continue giving care to our patients in the best way that we can. That comes out of our pocket. So comparison of pay, our EMTs at the moment are paid $22.61 an hour. That's the starting rate for our EMTs. Our request in the budget will result in a 2.5% pay increase, which will bring our starting rate to $23.17 per hour. The national average for EMTs is $23.45 an hour. Some places it's a little bit less, some places it's a little bit more. That's the average. To give some comparison, and all of these jobs are very important, however, giving comparison in the market, the average wage for an Amazon worker is $22 per hour. The average wage for a Walmart associate is $18.25 per hour. And the average fast food manager makes $28.50 per hour. So our request from the town as part of our budget was for $588,988. This is an increase of 5.2% over the last budget year. This is the actual payroll expenses and billed income from last year, which is 2025. So our payroll expense for 2025 was $602,152.98. This does not include the Woodstock Fair. Woodstock Fair is a paid private event that they contract us outside. So that does not come from our town contribution for payroll. Our billed income, which is what we actually received in income from calls that we rendered services to, was $227,390. Now, to touch on that, it's hard for us to budget an exact number of what we expect to take in because it varies on our call volume and what the insurances provide us. Unfortunately, our business is in emergencies, so it is in volume. So it's hard to predict exactly what level of call volume that we would have. Included in this payroll expense is not only our straight time pay for our hourly employees, it also includes overtime for things like sick call-outs, vacation coverages. We also provide additional coverages during storms. During the blizzards that we had this year, we had an additional ambulance crew that was available to assist, whether it be with another call or additional manpower to maintain safety of our crews in adverse weather. We also provide some standbys at larger events in town. We also have to pay our employees for training requirements. So all of the continuing education requirements, the Department of Labor requires that if any of our employees are coming in to do required training as part of their yearly certification renewal, that we have to pay them for it. Our current benefits that we offer to our employees as required by the Department of Labor, we offer our employees PTO so that we don't designate sick versus personal time. They accrue the paid time off as one. They're also offered a retirement account as required by the Department of Labor. We do not currently offer our full-time employees or any employees any insurance. So moving forward, the goals for our agency with our requests comes with a 2.5% wage increase. We also are looking at long-term goals for health insurance benefits for our full-time employees. This is a huge goal for recruitment and retention so that people can continue to provide insurance and medical care for their families while remaining dedicated to serving the town of Woodstock. We're looking at also expansion of level of service, and this is in a couple of ways. Also, we're looking to expand our level of service as EMTs in order to continue providing the highest level of care that we can to the residents of Woodstock, as well as expanding our service for more public education opportunities and things of that nature. So we have an extreme goal in transparency. We wanted to come here tonight and share all of the facts. We're very active on our media pages. We have a website, which is woodstockems.org. We also have a Facebook, Woodstock EMS. We are regularly reporting to town meetings. We go pretty regularly and try and share our statistics, exactly what's going on, what we've been working on. We're also very active at community events, whether it be in a standby capacity or providing some kind of training opportunity where we're usually at community events. We also have an open door policy. So even outside of this, if anybody is curious about anything that we do, we welcome members of the community to come and see our station, speak with our staff, see our ambulances, the equipment that we work with. I actually invite anybody if they have any questions or would like to see our ambulances. Our crew is here with an ambulance tonight, so we're happy to show exactly what we have and how everything works.
Real quick, our motto is 2 12-hour shifts. So there's 2 people that come in and work the first 12 hours a day, and 2 more come in and work the second 12 hours of the day. These guys covered 35,040 hours last year without missing a shift, without missing our first call. These guys also have a model where we're now catching second calls. So the ambulance is going out all the time. I think we're right around 153 calls so far since January 1st this year, and we're only into the 83rd day of the year. If they keep this up, they're on target for 700 calls in the town of Woodstock.
That's something that I should have touched on as well, is not only are we responding to the first group calls, we refer to them as second group calls. This is when an emergency is already taking place and somebody else calls 911 that requires another ambulance. Our staffing model that we employ right now allows us to respond to these secondary calls for a large percentage of them in the event that they occur. So that not only are we providing service to one person who calls 911, if somebody else is also in need of assistance, they're not waiting for another ambulance to come from another town. It's much faster in the same sense that our duty crew is getting help. To share some things that we worked on, as I mentioned in our partnerships and things that we were doing, these are some pictures that I wanted to share. So this was some of the training that we did with Woodstock Academy's residential staff. This is a picture of our crew from last summer, setting up a table for blood pressure readings in Roseland Park, which was very nicely newly renovated and is a fantastic space. And then last June, we provided some CPR training to members of the community. We were fortunate enough over the last few months, we received an anonymous donation for public training for CPR and overdose training. So we were able to certify approximately 40 people from the public as CPR certified, as well as send 4 of our employees to CPR instructor class as part of this. So we were fortunate enough, and we're going to continue providing CPR training to members of the public. So I would like to give anybody the opportunity who has a question.
My name is Joe Hennepin. I live on West Quasit Road. I have 2 questions for you. The first, why don't you bill for your meds and supplies?
That is just how the model is. Like I mentioned, all of our billing rates and everything are set by the state of Connecticut.
Yeah.
As far as I'm aware, none of our services around this area bill specifically for services or for supplies used.
Because every physician's office bills if they give you a cortisone injection. Hospitals bill $15 for a Tylenol. So you just wonder if that's another source of income, although it's more paper. And I don't know if it's restricted by the state for EMS or not.
So we had an agreement with the town when they started giving us more funding. Our goal is to get patients to the hospital, not to make money. If we were to start charging for everything, then we're afraid that the person who may not have the ability to get to the hospitals is not going to call the ambulance, and by then it's too late.
Okay.
The other thing we don't do right now is we don't take anyone to a billing agency. That's not what we're here for.
Okay, well, that makes perfect sense.
Great. We don't want anyone to make that choice. We want to be there for them.
Yep. My other question is about AEDs. Are there AEDs in all of the schools? Are there AEDs at Roseland? Because that's something that I moved up here from a little farther south, and they're everywhere. They're in grocery stores, they're in the airport. And people get very comfortable with the training. And I just wondered, in town, are they available? Don't think I've seen any.
So I can't answer for the schools. I think they can answer better for themselves when they get up here. But we just partnered with 2 of the churches in town. These guys were able to give them the training. They have AEDs in their both of the churches, the Congregational Church, and I think another one in North Woodstock. But I believe there are AEDs throughout the school.
Yes, that's true.
I think in big public spaces, there's a fairly large older population. And an AED can make the difference in someone's life, even if you have a 3-minute response time for an ambulance. So anyway, just something to think about.
AEDs have made
I know there's
direct life-saving measures in this town at least 3 times in the past year.
Yep.
The AED and the response time from the Moneybrook, Pungy, Woodstock fire guys getting there first, and the ambulance getting there, and the paramedics. It's truly a teamwork effort here.
Yep, fantastic.
Any more questions for these gentlemen? Yes.
Mary Beth Merritt. Actually, just a comment. I have to say that I'm very reassured by the service that you are providing. And I'm impressed by your response times because I know Woodstock is like one of the largest towns in the state and we have a lot of miles on our road. So thank you so much.
Thank you.
Any other questions?
We did provide a few handouts. However, we'll get it hold of the town hall so they can link it up to their page.
Next up on our agenda is item number 7, which is the Board of Education.
Good evening. Can you hear me? Yes. Good. So what you will leave here with today, advance to the next slide, please. Some acknowledgement and understanding of the urgency of this budget and the impact on student outcomes, which you will see very clearly in this presentation. Data-driven needs, a financial overview, and an understanding of what is within the scope of control of a public school system. The rationale for our budget ask, and an opportunity, of course, as we've done, to ask questions. I want to first start by thanking, first of all, this is my first year. My name is Christopher Roach. If I didn't introduce myself, I apologize. You have a wonderful town. The fire EMS, that I think day one I met them, and that's when we started pulling surge protectors out of classrooms. Sorry, teachers. But we had to do for safety. Very, very important, and I think that's really, really key. We partnered with the state police for Stop the Bleed training, working with Josh and the crew back there. They really helped us, Director of Emergency Management as well. It's a town. I don't see it as school and government side. I see it as a town, like one team. You work together in towns. That's really, really important to me. Got a great Board of Education. Jason with the Highway Department. We talk all the time. Thankfully, not anymore with the snow going to rain. So appreciate that. On this particular slide, I think two things can be true at the same time. Number one, we need this budget. I don't ask for something that we would not need. It's not, you will see very clearly in this presentation that this is data-driven. I'm not asking for 13% or 9% like has historically been the case. When I look at this, I know there's reevaluations, and that's not lost on me. I understand the impact locally because Connecticut and New Hampshire are the only two states in this country that decide to put all of the burden on the local taxpayer. I know that. I've worked in a number of states, and it's not like this anywhere. It's unfortunate, which is why I've been advocating like crazy. The lack of education from the state provides that imbalance of property tax increases. It's real. Schools. What happens in public schools is each year you are tasked with trying to come up with a budget to move the school district forward. Okay. The state of Connecticut is providing for 26-27 based on current projections, $4,545 per student. The rest of it is on local taxpayers. That is the formula that the state has adopted. What that means is decreased staffing. It means loss of essential positions and programs. So, for example, I came in my first day last year was calling people saying, I'm sorry you no longer have a job. I'm sorry you're moving to this position. I'm sorry you're moving to another grade level. Oh, they didn't tell you you don't have a job. I mean, this is the reality of, and that was because the budget failed. That's where we're trying to come in at what I deem to be, from an education standpoint, as reasonable as we can get, which I know is still a struggle. Families are struggling. I know the sustained increase is insurmountable sometimes, but I also see it from the school side, and I'm charged with putting together the budget that will best move the school district forward. And we do have amazing teachers, and we need to acknowledge that. So the result, let's start by last year having to make the worst of or the best, I should say, of the bad choices available. And teachers are not, again, having seen a lot of places, teachers are not getting the professional development they need. And we're going to improve that, because with improved professional development come improved outcomes, come students who are doing a better job in the classroom. Go ahead. So my sort of theory of action here is that if we invest modestly and strategically, aligned to the areas of needs that you will see in this presentation, clearly articulated with the goals, we will significantly increase academic outcomes. I've spent a lot of my career in school reform and turnaround schools. I know what can be done with a little bit of an ask. We can move the school district forward. We have the talent. All right. This is all about return on investment. So it's never about throwing money at an issue. I don't believe in that fundamentally. It's not about throwing money at problems. You've got to align your budget ask to key levers of school improvement. You will see that in this presentation. Next. Someone read that.
I've been practicing.
Get it right.
If a child cannot read on grade level by the end of the 3rd grade, their odds of dropping out of high school nearly quadruples. Every dollar we commit now saves many more dollars later in social services, remediation, and lost economic opportunity. Investment in education today is a savings plan for the future.
Thank you. Thank you for your reading of that. So the reason why I've chosen 3rd grade, through a variety of research-based indicators, 3rd grade is actually the best predictor of high school graduation. If you are not proficient in 3rd grade in reading, so if you're about behind grade level in 3rd grade, the likelihood of you not meeting the mark for graduation is 4 times greater. So 3rd grade, that's when you're reading to learn, not sounding out letters, but reading to learn and glean information. Critical grade level. I bring this up not only because it's the best predictor, but we have such a small window. When you start school, think about it. You start pre-K, maybe you're in kindergarten. You have such a small window before 3rd grade. And to the question that was asked earlier, yes, you can repeat a grade. What causes an additional year of not that you're paying, but what I mean tax-wise, it's an additional per pupil allocation, which we'll look at. But yes, there's a small window and we need to capitalize on that window. And here's the thing. Over time, to the tune of moving from 68 to 62 teachers, over time, over a series of years, from 23, 24 on to now, yes, with declining enrollment, but what you'll look at is when I say enrollment declines, we can't presuppose that that happens all in 2 grade levels or something like that, and necessitate moving a teacher or eliminating an FP full-time equivalent. If we reduce staff and you don't provide professional development, chances are you will see outcomes go in the direction that you see here. So where I'm looking now is specific to math outcomes. I'm looking at 66% of the students in grades 3 through 8, all grades 3 through 8, who took the Smarter Balanced Assessment did not meet standard. So 40% did, and that's a decline from the year prior. I'm going to tell you again, that is due to a lack of professional learning in the area of mathematics. It's important because you're going to see some of the asks that directly address that. You see schools who are above us who are what we call alliance school districts that worked in one, bottom 30 school districts, as well as an opportunity district, which is our bottom 10 school districts in the state. So you go to the next one. Literacy. This is ELA, English Language Arts, looking at the Smarter Balanced Assessment. Definitely better, it's not math, but early intervention is key. Last year, a terrible decision was made by me, in the summer, I should say this year, feels like last year, where we had to make a key move of moving a teacher out of reading intervention to grade 1. She's doing a great job in grade 1. But the problem is you have one opportunity as an SRBI reading teacher of struggling reading students, before that student gets to high school, and that's at this middle school level. So by moving that FTE, moving that full-time equivalent to grade 1, we deprive the opportunity of students in this school to receive required by the state research-based intervention in the area of reading. Terrible decision. It was a decision that was, I had to make based on the budget act. So to summarize, over the last 3 years, okay, you are seeing a decline in academic outcomes. The state of Connecticut, conversely, is moving in the opposite direction, incremental growth. So we're in an opposite direction of the state. So what do we know about high-performing schools? Well, I can tell you personally, we have the talent to be a very high-performing school district. It's not that high-performing school districts do more or spend more or have 75 different initiatives. You move from isolated professional development, right? So not just one and done, but a series of professional learning opportunities, particularly in the area of mathematics and literacy. So what I'm looking at, investment area, what it does and impact on outcomes. When I have that professional development item under investment area, I am also looking at that as a coach or a math specialist. Okay, so that is a position you'll see in here. And much like I've heard this before many times. Why do we have a coach? They don't teach. We need teachers. You're right. But Bill Belichick doesn't play linebacker for the Patriots or quarterback or any for the Patriots anymore for that matter. But he did a heck of a job coaching, which brought them great success. A coach has the knowledge, the pedagogical skills, and also the talent to drive overall change at a high level. Data systems, really paying attention to our data, and intervention/enrichment. Intervention is that position that we lost that I just talked about with SRBI. The enrichment position was the one I got more phone calls than I ever thought I would. And that was because you lose an engaging STEAM, science, technology, engineering, art, and math class that's hands-on problem solving. When we take engaging opportunities away from students, they are not as eager to come to school. I know this because I was one of them. What it does, professional development improves teaching in every classroom. One math coach hits every teacher K-8, both buildings, every student K-8 because they're going to improve our instruction. As far as the intervention enrichment, we need to close the gap. I always talk about this as close to grade level as possible. So you start that work immediately. The child's struggling in kindergarten, intervene early with a reading intervention so students move and thus do not need any sort of special education down the road. It's a proactive investment that needs to happen. Next, please. So this is from the school state funding, school state finance project, color coded in green, orange, and you can't even see the federal government's ask because it's so small. But you've got the local paying, as you well know, 70 to 80% of the actual expenditure per pupil every single year. All right. In 23-24, the state's late in getting a lot of things done. One of them is the EFS report. 19,818 per student. That was approximately 2,300 less than the overall average. You have Woodstock, Pomfret, Thompson, and Eastford. And irrespective of the, I'm not pointing the finger because what I'm saying in this slide is irrespective of where the funding comes from, it's still lower, right? And I agree because it's the smallest allocation from the state level. That's where it needs to come from, but it's not, all right? If I go down to the box below that, the rectangle, 2425, so you went from 19,818 up to 2463, excuse me, 28916. You see the federal funding per student is minute at $452, $152. The expected state contribution next year, as I said before, 45. And each year, the taxpayer locally bears the burden of public education. I would not pretend to deny that. All right, this is an important slide, and to really understand special education. Special education is not optional. This is as soon as a child is in special education who is eligible for special ed, starts receiving services, it's through an individual education plan, through a PPT meeting where where a child is provided services. This costs money, okay? And in this, I will say, Mrs. Nellis, our special education director, has done a tremendous job in keeping the costs down. When you look at the percentage change of total spending, that's general education in the first column, us versus statewide. We are lower than the state in overall change of total spending. When you look at the percent change of total special ed spending, still lower than the state. Dollar change of special ed spending per student, about half the state. Special ed spending percentage of total spending on par with the state, and the percent change of special education tuition spending significantly lower. However, in the highlighted row that says 40%, that's tuition as a total special education spending in 2024. What that means is, although special education is 25% of our budgets, right off the bat, it's 25% of our budget. In that budget, we start off in a K-8 realm with this, what I call a 60% budget. What does that mean? It means, and this is not a knock on Woodstock Academy, they do a great job, but we have to fund tuition to whatever high school the child goes to. So if they're identified as students with special needs, we must pay for that. We know that next year, 1.5 million comes right off the top of this budget that goes to Woodstock Academy because we don't have our own designated high school. That's a fact that is legally obligated. There's no wiggle room on that. There's no negotiation. That's what happened. We're obligated to pay the special tuition rates, irrespective of where children go. All budget cuts have to come from the K-8 system. It has to be the elementary or the middle school. We have no seat at any table relative to tuition. So we cannot negotiate that. We cannot say, no, we're not going to pay that. It is what it is, and we must pay it. Any cut must come from the elementary school or the middle school. Next slide. So the state special education funding formula, and the initial idea was that the individuals with disabilities, the IDEA grant through the federal government was going to subsidize about 40% of special education. Hasn't quite worked out that way, but the state has stepped in. And here's where it gets interesting. When a child is identified for a high needs outplacement, a very significant cost, we would look at that as 4.5 times our per pupil expenditure. So let's start with $20,000. Let's say that is the per pupil to make nice rounding numbers. 4.5 times that is 90,000. Okay. We are told that if a child exceeds that or is at or above $90,000, we can get reimbursement on whatever is in excess to that. So if I take a look at Danny, it's $120,000 to educate Danny. Are we eligible for excess costs? By the state's definition, yes. We'd be eligible for $30,000. Would we get it? No. We would get 2/3 to maybe 70% of it, perhaps. So it's not a reimbursement in terms of a grant that you're going to get. It is essentially an IOU that you don't know, or a loan that you will get paid back, but you won't get the full loan back. There's no interest on it. It's actually less. Next. So the priorities in this budget, and this is something that we spent a ton of time on from the very beginning, through building core values and guiding beliefs with the Board of Education, to meeting with staff members to hear about the needs of this particular school district, surveying parents, 105 of them, surveying community members that didn't have students in the school system, and surveying WPS staff. And thank you to the town for helping facilitate the outreach in terms of the survey. Our priorities for this budget: restoration of positions. We would like to bring back the enrichment position. That's an engaging, hands-on learning opportunity for students. Increase high-quality professional development is a key high lever for increasing outcomes for students. Maintain and add to our intervention program. Again, we did not have the required reading intervention program at the middle school this year. Should be alarming. minimize impact on student programs. We need to have the programs, we need to have the extracurricular component. Equally important to the academic piece is how do we get students involved? We, in this budget, are asking for increased JV sports because students need to be involved. An involved student is a happy student, is a successful student. And minimize impact on class sizes. Now, this is not just my opinion. I don't think that class sizes are as important as most people think. In fact, the only research on it that I've ever seen is that if you get below 17 in K through 2, maybe grade 3, it makes a discernible difference. In the upper grades, not as much. I have not seen any research to support that. If I hit 22, that's a magic number. There is no such research that I've ever read that would suggest that. So, not that 27 or 30 in a class is good. That would not be the goal. All right. Assumptions, contractual wage increases is guaranteed, right? Health insurance increases. The top two are 50% of the budget right off the bat. Why is it not 80 like in most districts? Because we're K-8, pre-K-8, we don't have the, we're not paying for staff at our 9 through 12. Rising costs of special education, we know outplacements are outplacements. I've already explained the excess cost formula, but it is expensive. And the increasing cost of aging facilities, we know these are legally, in terms of contractual wage increases, we're looking at a series of fixed costs. Next slide, please. All right. Full disclosure, I made a mistake. I made an error. This is now corrected, but in the NESDEC report, that's a projection where they look at your 10-year enrollment figures. We had just transitioned over to a student information system, which is new to us, where it pulled different numbers. These are the actual, as soon as it was brought to our attention, we resolved it that day. So what you have in front of you and in your packet are the numbers that are correct, and that's pre-K through 8 enrollment of 742. When you go down 10 years later to 2035, 36, you're looking at 733. If I did my math correctly, that would be a net loss of 9 students. Kindergarten through 8th grade is 9 grade levels, so if we do the math, there would be no impact to overall FTEs. I want to draw your attention, if you have this packet in front of you, it'd be page 13. In 24-25, you will note that grades 5th, 6th, 7th, and 8th all had 5 teachers, okay? Fast forward to 26-27, grades 4, 6, and 8 all have 4 teachers. That is a reduction. And while you may say, yes, but the numbers went down, I understand that piece, but this is a programmatic issue as well. This is how to help with the not going with an extreme ask, was to offset that with a per pupil, with higher numbers in the tier 1 classroom. But what does that mean? It means that instead of reading taught in one class and writing taught in another, one class. Less time, yes. It can work. Is it best practice? It depends on who you ask. The jury's out on that, but we are keeping the core instructional positions, that's the teachers who teach in the core areas, at 36.5, which remains constant from this particular year. Next. All right, we talked about salaries at 50%, tuition is 34.2, so that would be 84 already. Transportation is 7, which brings us, or 8, which brings us to 91 or 92 as an overall percentage of the budget. Maintenance and operations, although will seem like a very large ask for this upcoming year, still constitutes only 4% of the budget. And then you have professional and technical services, and supplies are very limited. The point of this particular slide and this information is that when you look at public schools, there is not a whole lot that is not contractual and or required by statute or law that you can make change. Where decisions are within the control, to a small degree, there's some wiggle room with respect to staffing, program enhancements, curriculum, and professional learning. All right, the elementary school. And I know I've spoken to some of our firefighters about this. One of the biggest issues at the elementary school, this is a 2024 facility study report from Veritas that went in and did a facility study. The one issue that was brought to my attention that actually does not appear because I guess it's grandfathered in is that there are no functional sprinklers in that elementary school. Much like we would have in here, where if there's a fire, you see the sprinklers up top, the water would come down. We don't have that at the elementary. It's not in the budget. If it was, it would be a huge ask. The point of this slide and bringing this up is in that Veritas study, which we will be meeting with our tri-board so that we can have discussions about what to do next. There is a lot of work happening at the elementary school. There's also a lot of work to do at the elementary school in terms of facilities. We know that this year we spent by February 82,499 in terms of repairs. That was by February. We know that there's work to be done. We know there's a lot to check off the list. I won't even go into all of it, but we're doing our best to keep up with it and working through the Board of Ed with the town to develop a strategic plan for facilities is crucial for our overall success. Go ahead. So in terms of the ask, I go back to the key levers of improving a school district. I'm proposing restoring the SRBI reading teacher of struggling reading, legally mandated. So you'll say, why didn't you have it this year? Because we couldn't. Because on the budget that was put forth or the budget that was approved, I had to make decisions. Do I have 28 fourth graders in a class? We had to make things work. Is it good? No, but there was no other way. So that was cut last year. Reestablish enrichment. Again, that was something that happened as soon as I got here. We had to make an adjustment. I'm not going to have 24 kindergartners in a class and set them up for failure. That is not an appropriate number to have in a kindergarten classroom. It's just not. Add a math specialist. Okay, again, going back to the Belichick example, it's a multiplier position. It impacts every student across the system and every teacher across the system. Special ed paraeducator is the fourth, legally mandated, bound by the individualized education plan. And a custodian, we have some serious aging facilities, particularly at the other building. And to keep up with the maintenance thereof, we need an additional staff member there. All right, so what have we done? Dina and I are good at a couple of things. Me moving schools, her finance, and the ability to lock people into agreements and get the best deal possible. So fuel prices, 2.4295. Did I get it right? Close. You've seen gas prices lately, they're not bad. We've locked that in to guide and to guard against market volatility. Recycling non-functioning electronic devices, because what else are you gonna do with them? And not cashing those in, but using those to purchase new phones. Working with a consultant to lock in a favorable transportation contract at a fractional cost of what others are paying. Leveraging professional relationships so we don't overpay for goods and services. And most importantly, holding organizations accountable for their business. When you do a terrible job, we're not paying. But plain and simple, and we're calling up and saying, this is what's not going to happen. Whether you want us to pay or not, here's what's not going to happen. It's the way it needs to be because you are accountable for the caliber of the work that you provide. I believe that with all my heart. Next. All right, professional development. This is something where, quite honestly, has all come from my network of people I know throughout the state and other states. And the altruism and the great staff that we have in starting book studies and doing things that are amazing for kids. Leader and Me visits. We visited a number of schools, okay? Stephen Covey, if you read the book, 7 Habits of Highly Effective People, very, very good read for leaders. Now we have a student leadership component of this, all right, that talks about time management, collaboration, leading yourself and leading others. Huge initiative. You'll see how much we've already done in terms of getting that in the next slide, but don't go anywhere yet. Free math professional learning, visiting the highest, second highest performing middle school in the state and having them come over for math professional learning. You know what? I work very closely with them. I know they're great. They would do it for free. They're not going to accept money. Great. Bring them in. I'm going to 2 Danbury schools where I used to work, 2 Blue Ribbon schools. We're going to look at their departmentalized teaching, why it's free. And second, they've got something great going on. Free AI professional learning by 2 experts that I know well that are coming in for free. In addition to an 18-year-old who's a brilliant kid who started 2 startups in middle school and is over at Babson, very successful. Free Covey Speed of Trust. I'm very proud of this. Bringing together leadership teams, superintendents, boards of ed, and other leaders throughout the Northeast region and farther. They're going to do this for free. This is a Fortune 500 type leadership opportunity from the Covey Institute. Again, retail value would be about $25,000. And then stopping the bleed, and I'm glad that the fire department brought that up, in civilian response casualty care, in working with the Connecticut State Police through Lieutenant Haglund and also Sergeant Stackpole. They did this for us for free with our administrative team in anticipation of understanding all of these school safety areas and how to best manage emergencies. But even better, they're going to come out and train everybody for free in the school district in August. So we are saving where we can, but we truly need to invest in the future. You have some amazing altruistic individuals, starting with WEF, who contributes approximately $30,000 each year to the school system. Incredible work. They had a St. Patrick's opportunity the other day, free for families, very well attended on a Sunday. The PTO at the Basket Bash, amazing work. The benevolence and altruism in this community is huge, and quite honestly, it's how we survive. I don't know if Megan Monowski is here. She's the local volunteer librarian. We're going to meet her ask with $4,000 worth of books because she volunteers her time to cover that library because there is no librarian. Nor is there in a lot of school districts, by the way. PD and clubs, people are writing personal checks. Shouldn't be that way, but it is. A leader in me, and this is something where I go home and write lots of grants. It is what it is, but we got to get stuff covered. All right, that's $127,000 over 4 years. The first installment of $45,000 is sitting there. The American Lung Association, Dina, took the time to write a grant to cover our air quality testing that is required of the state. And, there are many things that haven't been done over the last 8 years, to be very honest with everybody, and we're paying for that now. And we're also looking at cataloging all of these things so that we have a real record of what has been done and what hasn't by law. Here, I can't need a drink.
Why this budget is not optional. It's the line between decline and recovery. When we speak about the quality of a school system across Connecticut, there are only 2 truly objective measures that allow for fair statewide comparison, and those are student proficiency and student academic growth. Proficiency tells us how many students are meeting grade level expectations. Growth tells us whether students are catching up, keeping pace, or falling further behind. When both decline over time, the system is not simply stagnating, it is under structural strain. This is where Woodstock Public Schools now stand.
That is my opinion. Thank you, Dina. Next slide. And just to reinforce what was said on that, you saw declining proficiency, you saw growth that was not there. We have amazing teachers and staff here. We have to invest in them. We cannot just simply ignore what they need. The overall budget request, 4.97, is where board approved budget came in at. Go ahead. And we have a series of line items to run through. I have a number of other school districts. I have a ton of school districts here in terms of their asks. We're not going to go into that yet. We know that salaries and benefits together are the better part of 50% of a budget. Professional tech services are on the lower end of a budget. That is your tech and professional learning. Plant maintenance and operations, this was a huge increase relative to, but not relative to the overall budget. That was once about 4% of the overall budget, but went up 21.45%. Tuition, including special education, oftentimes, although cost of tuition increased exponentially, in some cases, the actual enrollment, the enrollment that we were sending to other places went down, thus necessitating or leading to a negative, meaning that the tuition went down. Transportation, including special education, went up 4.86. And supplies and technology, again, that went up significantly because teachers are reaching into their pockets to buy supplies. That's not normal, nor should it be, and it's not going to be. We needed to increase that. Overall, 4.97. And I am happy to go through each of the slides with you in summary. Actually, should I do it by ask questions on each of these, or do you want me to go through every page of this?
No.
Perfect. Every page verbatim. No, I'm not great. Okay. So in summary, and I'll just go through the summary of this. Let me just get my summary sheet. Page 1, as we talked about salaries, when we look at the overall ask, 50% of which comes from salaries and benefits, that's what you're seeing on page 1. You're seeing some increases and decreases that happen to do with special ed. That's simply charging it back to a grant. That's why it's in parentheses. Page 2. On page 2, increases are contractual and new staff. 3. Subs, we do have the IEP meetings where we do need the classrooms covered, so we're looking for 2 long-term subs to cover that. And 2 stipends for homework club, having student council in there, and also contractual increases, adding a Leader in Me club for student leadership. 4. All right, so what I talked about before with respect to athletics changes lives, I believe that. We know that that's contractual, and it's the addition of JV. I heard that loud and clear from families. We need it back. Right? Health insurance, the renewal rate of budgeted for 12%. That's new position. That includes the new positions and also life changes on that. So security is based on salary and page 5. So on page 5, retirement, again, percentage MERS, percentage based on salary. Medicare, same. Sick leave stipend is a contractual obligation. If we anticipate retirements, that might be higher than it normally would be. Unemployment, we don't expect layoffs or resignation, or we don't expect layoffs. Page 6. Professional development, big driver. What is that number? Yeah, so it's a big driver because we said that professional development is not a panacea, but it's definitely an antidote to where we are right now, an improvement. Also, people services, it looks like a huge increase and a decrease. That's simply a child moving from one level to the next. Okay. Page 7, other professional services, attorneys cost a lot of money. Increase in legal fees based on historic usage. We use Shipman and Goodwin. Our actuarial services for the audit, it's a 2-year deal. The sewer fees, that's historic. Music program for Woodstock Elementary, that encompasses an accompanist, as we have at the middle school. Page 8, repairs on the instructional equipment. That happens to be kiln cleaning, inspection, laminator service contract, recess equipment. Repairs at the elementary school, kiln cleaning, inspection, laminator service contract. Repairs, maintenance, West, and then maintenance, WMS, they're too voluminous to read. We'll be here for the rest of the night. Transportation, purchase services. Property insurance is recategorized. It's actually on the next page, page 9. Insurance and liability, that's to bring it under one line item. You'll see one line item versus a number of them. Advertisement, what that has to do with is record destruction, recruiting, pre-K screening, and the like. Page 10, You see parentheses, excess cost, that's the formula I talked about, 4.5 times the per pupil. That's the anticipated monies back to us in the subsequent year based on current enrollment. Tuition Woodstock Academy, 5% tuition increase with fewer students. Tuition at BOAG based on anticipated enrollment. Same with Putnam and Killingly. Magnet tuition is based on enrollment. All of this is based on enrollment. Private special education at cost, reductions on page 11. Page 11, there's reductions due to students leaving, graduating, or moving back in-house for educational services. Supplies for the classroom, I told you those are going up in large part because of our teachers. It hasn't been funded for the gaps in classroom supplies. WMS, same. In addition to some for field day and SRBI plus agendas. Page 12, tech computer software, that's for student health records and for the libraries. Athletic program, 2 teams need replacement uniforms, graduation supplies when grade 8 moving up, replacement gowns, in addition to the cost of the Luce Center. Page 13, heat. Locked in at 2.4529 is not what I said. Per gallon plus tax includes the additives for the cold weather. And an additional 2,000 in the event that we do run low. Fuel for the generator and fire pump, we're not budgeted for separately. Now they are. Electric is based on historic use. Transportation supplies reduced on historical trends. The new language arts textbooks are based on needing fewer of them. Page 14. Replacement textbooks based on student census. Books and periodicals, add books to the library at West. This was important. It's about 3,000. I can't read it. Yeah, almost 4,000 on books because the elementary needs an upgrade in books. The supplies for go to page 15. You'll see big increases on the side of the principal office. That's not for lunch. That is actually for new radios for both buildings. The middle school has the Fisher-Price variety that's not appropriate for schools, so they will be getting additional upgrades to those radios. And on the equipment side, classroom, WMS, replacement chairs and desks. We have some antiquated furniture. Equipment for the district, power tools, replacement, vac cleaners or the vacuum cleaner, cafeteria tables for the elementary, truck repairs, and repairs to the zero-turn mower. Computer hardware at West, replacement phones for West, and current phones are at the end of their life expectancy. Page 16. Student instructional software, there's contractual increases that pertain to Ames Web, that's a screener, Amplify, brain apoplexia, core reading, reflex, refrax, reflex and frax. Those are all instructional programs. Same at the middle school with different instructional programs with increase to IXL. On the admin software, that's Raptor. Remember we talked about security being important. It is, and we screen people who enter the buildings because that's safe and it's what we should do. ERP Pro Cloud is based on finance going to the cloud so that we don't lose our financial data. Admin software contractual increases to Power School. The website, Seesaw, which is the parent communication tool. Also the admin software at WMS, contractual increases to Decrease, Securely, Power School, Vector, and Frontline. That's for hiring and also evaluation. Dues and fees is the final entity. Increase the memberships due to the increases in the Regional Education Service Center organizations to assist our students. That concludes, what do you got there? Next page. So that's where we had the non-lapsing and the 1 point, read it out, 1.7. No, I know that, but.
$184,569.70.
That's a non-lapsing in addition to the I believe the contingencies on there for special education, $150,000. Again, when a student moves to Woodstock, irrespective of where that student goes, we are paying the tuition I could finish my other, no, I'm just kidding. Yes, the special ed contingency is for students who, if we have somebody move in midway, we have to pay the cost. So we don't know that upfront. That's an unknown. Therefore, we must have a contingency available. The non-lapsing is when there are money is left over from the prior year, and this dates back to 2025, right, on the audited. 2% of that can go right back into a non-lapsing, would go directly to the Board of Ed, and you would use those for capital expenses and or non-recurring costs. Good. That concludes, oh, yes, no, it doesn't. Let me go to that one. So I know, and Chandler said this too, when you look at a capital improvement, I know this isn't really a capital improvement because it's not as though we're committing funds to this at this moment. It's more of a wish list. And as such, you'll see items on here. I actually listened to 2 budget meetings from the past, and these same items were on there, a lot of them. But we're looking next year to do our best to do the encapsulation that's noted in the Veritas study due to the moisture and drainage issue. I think it's really important that we get a generator over there at the elementary school, so we're not canceling school because the power went out. Lighting repairs at the elementary. We are getting quotes for the Hobart dishwasher. We got an issue over here with respect to filtration in the cafeteria. Clocks and intercom system at $25,000. We're getting quotes for that as we speak. Actually, someone's here today. Repairs to the maintenance garage in the back of this building, and determining whether or not to replace an F-350. It's on there for $65,000. That's in reference to whether or not we're going to move forward with all of the snow removal. I don't know, and this is where the delineation of specific duties, town versus Board of Ed, and where that line is, so that we know, is that on us, and if so, we need the proper equipment to do that the right way and not a shovel. That concludes the presentation. I know it doesn't. So what do we get out of this? It's a first step, in my view, of improvement. There's two out of three were key positions that were here last year, so we're just getting them back. We're struggling in math. We had a math specialist. That's why data is important. You look at the data, then you say, okay, how do we address those needs? Well, the best way to address that need is with somebody who is highly skilled in the area of math pedagogy. Professional development added to address areas in need. Everything we've done professional development wise this year was on the house. Free, we didn't spend a penny. We provide, but we can't do that again. You only have so many people in the state, and nobody's going to run out here and do professional development for free. Bottom line, we need experts, and they're going to come out. We have to pay them. Provides legally mandated services. We have to pay the cost of special education and other legally mandated services. And reestablishing JV sports and other extracurricular activities in the best interests of our students. And they align, in my estimation, to what high-performing school districts do. It's a great return on investment, and when schools do exceptionally well, that's a win for the community. I believe that concludes the presentation. At this time, thank you for your patience. Questions from the group?
Any questions? Thank you. Oh, there was one. Oh.
David Murphy again, as a follow-up to the stay back.
Yeah.
How many stayed back last year?
Last year, I was
third grade.
A few students stay back in third grade. It's usually something that's done in kindergarten or first grade.
Okay. All right, good. Second one, I wholeheartedly believe that early intervention, as you indicated, is
absolutely
highly important. If you're not on track by third or fourth grade, yeah, you're probably going to hit that cliff somewhere down the road. So if you follow that, and 40%, according to here, are not tracking at math, how come when I open up a local Villager paper, like 80% of the kids by these population numbers are high honors or honors? Math doesn't work. I mean, that's really a takeaway, but it's there.
Appreciate it. I was not aware of that. I didn't know that was, I haven't seen anything about 80%.
Hi, Aaron Farbo. Thank you for advocating for the Woodstock schools. I really appreciate it. My question is based on historic voting in this town, this budget most likely gonna get voted down, gonna get cut. What are you looking to cut in the first round of cuts when it inevitably happens?
So what I don't like, and I appreciate the question, I don't like to do a think aloud in terms of who should go, what should go, that sort of thing, because I don't think it's the respectful thing to do to the staff. I also think that, there's nothing in here that's not needed. So for me to answer that would be say, I gotta cut something that we absolutely need, so I don't wanna cut anything. I don't like, and just to be full transparency, I don't believe in games like, let's start saying we're gonna get rid of sports. Maybe we don't need kindergarten, put that out there and get everyone to come to them. We don't do that. I'm gonna be honest, and that's why I asked for a budget in the 4s versus budgets in the 9 and 13 historic range that I've seen. So I can't really answer that, to be honest with you, sir.
We have a question back here, back up front.
You can hold the microphone for me. I actually dictated some notes while driving here tonight. Thank you. That's a lot of detail to absorb. I appreciate it. And I'll digest the line items offline. But my thoughts while I was driving here tonight, I'd like us all just to step back, look at the whole picture tonight. We include the education-related spending in our schools, tuition at Woodstock, special education placements, out-of-district costs. We're allocating roughly 70 to 73% of our total budget to the school district. That leaves 27% or less to run the rest of the town with fire, EMS, circuit breakers for tax relief for our seniors, maybe heating fuel assistance, libraries, parks and recreation, the list can go on and on. My question is this something that's sustainable and even tenable to request a town to give the school district that high of a percentage of the entire budget and leave essentially the rest of the town fighting for table scraps?
Yeah, and I think that's the conundrum that we're in, sir, as a state. Having worked in other states, this is not even a discussion, because what happens is the state has decided that the local taxpayer, us and New Hampshire, are on the hook for 70% of it. That is fundamentally wrong. I'd love to invite you to join me. I've been to the state many times already because I've seen other systems that work. And what we're doing in the state of Connecticut is not acceptable. I agree wholeheartedly that it's a lot to ask and it shouldn't be that way. I don't have a good answer in terms of is it fair? No, it's not. But there's got to be some advocacy around this at the state. That's how I would answer that question. I wish I had a better answer for you.
Beth Merrick. Could you give the name of a high-performing school district compared to?
So does it have to be in this particular, well, Pomfret's a high-performing school district.
One that you admire?
Pomfret?
As opposed to the whole state, maybe?
Oh, I was saying Pomfret is a high-performing school district. I would also look at some other states in that alliance bracket that have lots of issues but are overcoming them. I ran one that was a school distinction every year, but I would also say that's not a high-performing district. So I was going with Pomfret as a regional.
Okay, and this might be more for finance, but the Woodstock Academy budget is not part of this, right?
Yes, it is.
Oh, it is? Oh, okay, phew. Thank you.
Hi, Margaret Adams. Can you tell me how the enrollment in the school has changed in the last 3 years? Has it gone up or down?
It's gone down.
It's gone down.
Yep.
By what percentage?
I'll tell you in 1 second. So 775, 756, 747 at the October snapshot. These are all October dates. Projected at 729 next year.
Other questions? Okay. So, thank you for your very detailed report.
My pleasure. Thank you.
I have no questions, and I've given people last call for questions online.
Thank you for your attention. I appreciate your time.
Next up is Karen Fitzpatrick, who's going to talk about town revenue.
Good evening, everybody. Not gonna be, oh, I'm sorry, after this one, the next one. And that's fine, you can just leave it here. So tonight I'm just gonna talk a little bit about how we fund these budgets and where the money comes from. So this spreadsheet that you see up here is what we call our estimated revenues. Revenues that we're not 100% guaranteed, but we think we're coming pretty close to being able to utilize towards funding the budget. So how we determine all of this is we start off with the grand list. And this year, our grand list has increased overall for the town about 30%, which was equivalent to about $1.2 billion. That times the current mill rate of 24.1 mills brings in about $30,354,000. And then we have to backtrack circuit breaker abatements because we have a lot of incentives for people here. We have a lot of senior programs and farm programs, abatements that help people save money on their taxes if they qualify. So altogether, right now, the total amount of revenue that this grand list for 2025 has generated was about 29 million. So we take that amount and we deduct what the current fiscal year 25-26 budget has for revenue. And that brought us with an increase of, 7.4 million to be exact. Well, we know that these two combined budgets does not warrant a $7 million increase because then the taxes would be extremely unattainable for most of us here in town, I think. So when I look at these numbers, the 29 million that the grand list has generated, we take that number and we divide it by the current mill rate, which is 24.41 mills. That makes 1 mill approximately $1,208,000. So that's where we come into figuring out what the combined budgets are and then how many mills it would take to pay for that budget. But before we get to that total number, I just want to quickly go over some revenue sources so everybody understands where the money comes from. And like Chris had mentioned, the majority comes from your tax dollars, unfortunately. We do get property tax, we get motor vehicle supplement, we do get interest in lien fees, and we're still collecting for prior taxes. So that right now, based on the current mill rate, would equivalent to 29,978,000. As far as state grants, we get what they call the education block grant. That is for the education. And right now, we've only been getting about 4.8 to 4.9 million. And that's what Chris was trying to say, is that the education is really based on the taxpayer more than the income from the state. We're not seeing increases every year. We've seen some decreases in state funding. So altogether, we're getting about 4.8 million from the state to fund schools. And then we have some other income, you know, we have permit fees, we have dog license, town clerk fees, landfill, you know, different types of other fees that we have coming in. And this year we're guesstimating about 953,000. So altogether from our estimated revenues, we're looking at about 36,104,000. And just to explain really quick, we do have an under and over column. And what that just means is this current budget, if we are receiving revenue more than what we budgeted, we're putting it towards the new budget to help offset the cost. If we were to pass this combined budget of $31,522,343, it would require a decrease in the mill of 3.79 mills, which would be approximately a 20.62 estimated mill proposed for this budget. I would not take, my recommendation is I know people are seeing high increases in their assessments. Please do not take this current mill rate and multiply it by your current assessment because it's going to be totally wrong. The mill rate will be set once budget's passed. That will be the Board of Finance's job. They will be coming back on April 7th to talk to the Board of Ed and the Board of Selectmen, what they feel the town can absorb for expense for these budgets. They may make us decrease the budget, which means there would be even a more reduction in the mill rate. So these are just estimates. And the other thing, as of April 7th, these numbers can change because I'm still waiting for March collection rate from the tax collector. We don't have those numbers yet. So that could give us a little bit more in overage from this year that would help offset next year. So that's basically how we come up with the numbers. Does anybody have any questions?
Dottie has her hand raised online. Sorry. Dottie, you can unmute.
Have I been called upon, Mr. Chair?
Yes, you have, Dottie.
Thank you. I saw in the chat column, people were asking about how to ask a question if they are on the Zoom. So I just wanted to make sure people understand that if the person moves his cursor, his generic, way down to the bottom of the screen, there's a place where it says to chat, or it says to react. The react shows some images, and one of them is how to raise your hand. And that indicates to the person who's the host that this individual wants to ask a question or make a comment. So at the very bottom of the screen, next to where it says chat, it says react. And once you put your cursor there, the emblem with the raised hand will appear. Then the individual just clicks on that, and then the host will in time call upon that person. Thank you.
Thank you, Dottie.
We have another hand raised from Mr. Richardson.
Question that one.
Mr. Richardson, go ahead.
Unmute.
I believe he's unmuted. Mr. Richardson, I see your hand raised, and it looks like you're unmuted, but we can't hear you. Okay, I'm going to move on. We have another question online from Linda McGee. Linda, go ahead and unmute and ask your question.
Okay, thank you. This is for the first selectman. I'm just wondering why the town hasn't locked in the diesel fuel prices for stability like the school system has currently done. Thank you.
The town has locked in gas prices and fuel prices in the past. It's been a win a couple of times, so it's been a loss a couple of times. It's very difficult, as I said before, to predict the prices moving forward. We have had times where we're still locked in at a bad number. So at this point, we are going to look at it again when they come up for the new bid. But at this point, we are susceptible.
Isn't it just easier though when you're budgeting to already know what a set price is? I mean, I understand the fluctuation, but given the rest of the budget, to know that you have a definite number to work with?
We are speaking with a couple of different vendors at this point on this very issue.
Thanks.
Question from one of our members.
Actually a comment, and I'm actually speaking as a citizen right now and a taxpayer to the issue of revenue. So I've been doing this a long time in different capacities, and this problem of the state underfunding education is not a new one. It's just that it has a drumbeat right now. So it's important that you all beat the drum. Get in touch with your reps and tell them to take some of your tax dollars that you spend income tax, sales tax, gas tax, all the things we get taxed on, and ask them to send it back to your community. Because that doesn't mean we're gonna spend more money on things because we have more money. It's gonna help pay for the things that we need. You really need to start doing that. You really do. I started, disseminating some resources and things to do that. If you need any information on that, just reach out. I'm happy to help you send the message.
Any other questions for either the selectmen or board of ed people? We have one online. You have a question about?
Dave. Dave's trying again.
Okay, Dave's still trying.
I just messaged him to please type it in if he's not able to, if he's having audio issues.
So we should chat amongst ourselves.
No, I mean, is there anyone else?
I think not.
Okay, it looks like the hand went down. So I don't see anyone else online.
Okay, so I believe my role is over and it's back to you. Any announcements? Herman.
All right, so under announcements, the 7th of April, the Board of Finance will meet and we'll decide what we will recommend as a budget to go forward to the town meeting and then to the referendum. We have some comments that we heard tonight that we should consider before we make any recommendation, one way or the other. And I hope everybody will think seriously about them. The next meeting to follow that would be the annual town meeting, and that will be here once again. That will be here at the Woodstock Middle School auditorium. That will be on April 21st. 7 p.m. And this will also be a Zoom type meeting. So if you can't be here personally, you can follow it on Zoom. And that information will be provided on the town website. And then from that, we will move to the referendum, which will be on Tuesday, the 28th from noon till 8 p.m. at the town hall. And once that vote has been counted, if in fact the budget passes that has been recommended, the Board of Finance will set a mill rate for the upcoming year. I want to thank you all very much for being here tonight. And if you have any further questions, please don't hesitate to reach out to. If there's not someone here that you personally know, call the town hall and we can get the answers for you. Mr. Paquette?
I just wanted to state that there is no early voting on a budget referendum, and absentee ballots will be available from the 22nd on in the clerk's office.
Did everyone hear that?
Yes.
There is no early voting, but absentee ballots will be available from the 22nd forward at the town hall. Okay. Anyone else have anything? Motion to adjourn. You may.
I move that we adjourn.
I will second it. We have a motion by Mr. McDonald and a second by Mr. Perizzo to adjourn. All those in favor? Aye. Opposed? Once again, thank you all.